Well, my hope is that in the short 25 minutes that I have is to get you excited about your future. Excited about establishing your vision for what your future will look like, understanding how to execute on that future, and I would encourage you to be much more proactive than reactive in your marketplace. I'm going to show you my organization and how it evolved over 20 years. From one hospital in 1997 with one clinic, only a few physicians, to 20 years later to 3 hospitals, 16 primary care outpatient clinics, and 350 physicians, 150 that are employed by the organization, and 250 or so, 200 physicians that we engaged in private practice to join our system to admit their patients to our hospital. This is what our main campus looks like. And in 1997, we had a vision of doing a hub and spoke, where this would be the hub campus. And when we created all those primary care clinics and smaller rural hospitals, they would feed into this for the more complicated care. Now, this is not a tertiary hospital. It's not a university hospital. It's more of a secondary community hospital, and many of our tertiary patients get referred on to Mayo Clinic or the University of Minnesota. But we'll show you what we can accomplish in even these settings. So here's our service area. It is over 1,400 square kilometers and mostly rural. We have the A to Z of services, from everything from the emergency ambulance pre-hospital all the way to the hospice center for death and dying. The hub is right here, and then we surrounded it with clinics all like this. In a very competitive healthcare environment, we wanted to put up that hub so that we could, and surrounding spokes that would feed into our system and to make our system grow. So just a quick little bit about it. In Ridgeview, we're an independent regional system. We serve now 300,000 people in 5 counties. We offer this wide variety of services. I'm going to talk about 212, which is innovation that gets spurred when you come together with creative minds. We are one of, if not the largest employer in Carver County with 2,100 employees, 350 physicians. And I put up there volunteers. As our population ages, I would encourage you to engage volunteers in your hospital system. They can do a number of tasks for you, and they are probably your best ambassadors out in the community for enacting change, particularly in the areas of public health. So just to kind of lay the groundwork and set the stage for my talk to you is an understanding of what the major drivers are for you to want to change. Number one is cost and quality, but cost and quality that's driven by people outside of your organization. So this is just a quick example of every hospital in Minnesota, where I come from, that the Department of Health collected all the information about cost and quality on every hospital. This is available, and what they've done is they've looked at scores. So my particular healthcare system scored 92 out of 100 points, pretty good, the 90th plus percentile. Some did not score as well, and they put them on a scattergram. We didn't have a lot of say in what this looked like. I want you to be prepared for the future of people outside of your industry that want to display data about you. That's you want to be proactive versus reactive to this. Here's Ridgeview up here, and on this continuum, the difference in quality along this axis is very little between all of the hospitals in the state. We actually share clinical protocols across, and we try to get standardization. But look at this. The difference in cost is immense. This is on a DRG basis or an admission basis, and it's cost indexed or adjusted for severity. Imagine what the public thinks or the insurers think about that kind of spread between any hospital admission. All data collected by an outside party and now available. The playing field, be aware of what that is. What is the playing field and who represents each one of these types of services? From the patient who starts in their home and they transverse this at different times in their life or when they have a chronic condition. Understand who owns or who has these parts of the playing field. Everything from the e-visits to the wellness center to the physician clinics all the way on to home care on this end. An e-visit we'll talk about in a second. So what are some of the drivers? These are metrics that people outside of us that look at us to determine whether we are a quality organization. What's our hospital length of stay by diagnosis, for example? Do we avoid hospital readmissions within 30, 60, or 90 days? How are we doing with radiology costs? How many CT scans are performed in our emergency room? Those kind of things. All metrics. Here's another one to be aware of. In the United States, we pay about 95% of our healthcare dollars go for access. Building of clinics, access to a doctor, access to a hospital. And yet most know that the drivers of health are more around behavioral patterns, social circumstances, whether someone smokes, what their sleep patterns are, their diet, their exercise. What role do we play in that in the healthcare system, the hospital side? We should be paying more attention to this because most governments are now paying attention to this left side of the screen. How do they reduce healthcare costs by paying more attention to these other things like social circumstances, behavioral patterns? This is changing paradigms that we used in our organization. We used it organization-wide. The mistake we made, we didn't really talk to our physicians directly about how this impacts them. This delayed some of our changes that we wanted. Physicians need to buy into these paradigm shifts that are before us. We're no longer in silo managed care. Yes, physicians still see patients in an exam room, but they need to think broader, more about the enterprise of care. Coordination of care versus just episodes. Looking at not just discharge, but transitions. We don't ever want the patient to leave our system, and we want it to be seamless, no matter where they go to get health care. Could that be in a wellness center? Could that be in home care? We want to have seamless transitions. We want to, instead of caring for the sick, we also want to be aware of keeping people well. A lot of that is in the outpatient setting. We also want to be aware, as we set our vision for the future, what are our consumers expecting? And in this case, this is a great slide about what consumers want from primary care based upon segments of age. So those millennials, 18 to 29-year-olds, have a much different idea of what convenience is. They would prefer convenience to be 24 hours a day, 7 days a week, better yet on their phone. They'd like to have care done there. They'd like to not leave their apartment to get care. Knowing what your customer wants by age segments and by type of care, convenient, access, value, reputation, and quality is very important. Very different from an 18 to 29-year-old versus a 65 to 85-year-old who has a chronic condition. So here's what our strategy is. It's very simple at our organization. We always start every strategy session with this one question. What's in our healthcare portfolio that makes us relevant to these stakeholders? Consumers or patients, employers, and in the United States, employers pay much of the insurance premium, or the insurance companies and the government. What makes us relevant? What's in our portfolio? We look across our line. Do we have a gap in our portfolio where we don't have service in a geography, or we don't have a particular service that consumers want? For example, an outpatient testing facility. And here's our goals to make us what we think would be the premier healthcare system in Minnesota. Now, we're in the shadow of Mayo Clinic. We're 90 kilometers from Rochester, Minnesota, where Mayo resides. But here's some of the things that we have to do just to stay relevant. Reduce variation. We'll talk a little bit more about that in a second. But that is increased standardization. Not so much to compete with Mayo, but to compete within ourselves. If you go to any one of our 4 emergency rooms, the sepsis protocol is identical. The treatment of sinus infection is identical. Patients know what to expect when they see the Ridgeview emergency room sign. I don't like to equate it to McDonald's, but you pretty much know when you go into any McDonald's worldwide, for the most part. The same thing in our system. It's consistency and standardization. We want to prepare for marketplace disruption. Who wants to disrupt us? And I'll show you a slide in a second about others that want to change what you do through technology. The common electronic medical record, so all the data, no matter where the patient shows up, is there. We don't have to ask them repetitive questions, for example. Common clinical pathways. Our supply chain. We have the same catheters in all of our buildings. We don't let one building deviate from another. We can then negotiate pricing discounts by having that kind of scale. As John Leach referred to earlier this morning, scale is really important to build that. Foster innovation. We find that physicians are attracted to us because they like the creativity and innovation that we can provide. That means we want to be the employer of choice. So we focus on the customer experience first. When quality and cost is perceived as similar, and in Minnesota, we're pretty much equal in quality across institutions, it really is convenience or service that you provide to that customer. Knowing when convenience becomes secondary, when somebody has a chronic condition, for example. Don't lose the personal touch. In all that we talk about today, you hear a lot about protocols, guidelines, establishing standardization, consistency. Don't forget that what the consumer relates to most is the personal relationship. They assume that you are experienced and have the best technology. So this is our one of the campuses we built in 2011. It's called the Hospital of the Future, but it has no beds. It has a 24-hour emergency room. It has a 24-hour what we call urgent care, which has, for a sinus infection, 24 hours a day, $80. You can go in, get it treated. It's embedded in the emergency room, and patients are treated based upon their diagnosis and charged appropriately. This has easy access. You can walk in without an appointment. You're guaranteed to be in and out if you're just in urgent care in 60 minutes. In and out in 60 minutes for someone who just walks in the door. That's something that we actually promote in our marketing. We have started e-visits there, and our emergency room physicians are doing the e-visits. We've looked at being transparent about cost, and we have bundled payments now. So there's one fixed price, and I'll show you this in a second, for your joint replacement. Even though this has no beds, we do total ankle, knee, shoulder, and hip replacements on an outpatient basis here. Now, there is a protocol based upon the patient, their age, any chronic conditions, those kind of things all add up. We started off when we opened at about 25,000 urgent care ED visits. Last year we had 45,000. We are the dominant player in this marketplace with this Hospital of the Future with no beds. It has everything in it. It can take care of about 90% of what any of you need out there without having a hospital bed. As I said, we do surgery there. Went from pretty basic elective outpatient surgeries of arthroscopic surgery. We now do, as I said, total joint replacement there and send the patient home. The patient is followed by our home care nurses in their own setting. Patients must go through a protocol where we get to assess their home to make sure that they're ready to go home immediately after surgery on the same day. That's what it looks like. That's the price tag in US dollars. By the way, if any of you would like to visit, happy to tour you around there. We have visitors from literally all over the world that have come through to see this setup. Clinical variation, I want to talk a little bit about that. As I said, it's so important to, if you have your name on anything, in our case Ridgeview on 20 or 19 sites, that the consistency is there for the consumer. They know what they'll get. So sepsis is one of the clinical areas that our doctors focused on. Not only did they focus on sepsis, but cardiac cath minutes from door to cath in the stent in, setting all those standards. Now, not all of our facilities do the cath, but they all have the protocols in place to understand. So in sepsis, we wanted to go and make sure that we had the 6-hour goal in the window where everything was done for that patient. Here's the protocol for it that our doctors developed, and the guidelines for it that get them through, the patient through that in 6 hours or less, start to finish. The key here is it's in all the EDs. There's no variation within that. We want to foster innovation. As I said, we believe this is one of the major drivers of having an employment workplace where people seek us out to come and be employed. People like creativity, they like innovation, they like to have a voice. These are, about half of these are companies that we own a certain percentage of, that we help foster the innovation. All of these came from outside of your traditional hospital and healthcare system. They came from entrepreneurs who saw an opportunity to want to change what we were doing. Instead of turning them away, we actually embraced them and helped them foster their technology or their idea and help them get it implemented and tested in our organization. They actually sought us out for many reasons, but it's important for our attractiveness as an employer to foster this kind of innovation. Here's one of our companies that we own 5% of. This, you can get your ophthalmology refractive eye exam through by looking at your laptop computer. All of my ophthalmologists went like this, said, why would we want to encourage this to happen? Because it's going to happen anyways. What they fail to realize is that about 60% of refractive eye exams also end up in additional services. Maybe they have a stigma or something else that requires an ophthalmologist. These folks will have exclusive relationships in metropolitan marketplaces to refer on. That's part of the innovation of thinking differently. The ophthalmologists didn't want to change. Technology was going to change it for them. Their opportunity was to say no or to be a part of it. Learning from other services. I want you to get outside your box. I always ask the students at the University of Minnesota when I teach a one-day class on innovation, what are you reading? What are you reading? If you're reading only healthcare books, you're stale. Who are you hanging out with? If you're only hanging out with the people in this room, you're stale. You're boring. Stop doing that. Get outside of your box. Go meet with other people, other industries. So I sit on a bank board of directors. This is the banking industry. This is all technology that has disrupted banking. Do you need to walk into a bank anymore? No, you don't. My 21-year-old daughter sends me money on her iPhone to my iPhone using Venmo. How many of you use Venmo? You really should use Venmo. It's really cool. Or PayPal. This is looking at other industries. I think the banking industry is the canary in the mine shaft for us, because this is how I think most people in the next 10 years are going to get their care. Already I can hook up a device to this, put it on my chest, send a 1-lead EKG to my physician. Does he want my 1-lead EKG? No, he does not. But I can send it to him if I want to. Think about the future. A camera on here that's more intensive that I can send to my dermatologist a picture of the mole on my neck. That's the future. We've got to figure a way to embrace that and put that into our future thinking and our visions. Adoption of clinical pathways, and I just put this in end-of-life care. I would guess it's no different in the Czech Republic than it is in the United States. We spend way too much money on end-of-life, with horrible results, not just the death of the patient, but the last 60 days to 90 days of that patient's life. There's a better way to do that at a reduced cost and better humanity for the patient. I put this in here, personalized medicine, only because this company, OneOme, that does pharmacogenomics, developed a test at Mayo Clinic. They actually spun it off. They brought it to my medical center first to roll out. Why? because we're small, we're adaptable, we don't have a bureaucracy, we're creative in entrepreneurship, to understand how pharmacogenomics could actually benefit the patient. It's been out for almost 18 months in our organization, hasn't been adapted by physicians almost hardly at all. They don't like it. Why wouldn't they like that? It's too difficult to understand. We rolled it out through physicians instead of our pharmacists. And those are the mistakes that you'll make along the way. It's okay to, by the way, to make mistakes in healthcare as long as you recognize it, share it with other people, and get better. Don't be afraid of making mistakes. Lastly, the last 3 slides I have are just on national comparisons of our medical staff. Our 350 physicians participated in a survey of physicians in Minnesota and then nationally. And I took out just 3 slides of almost 200 that are in this, how do physicians feel about where they're at. And what's important on this first slide is this. Here's what they looked at: emotional exhaustion, depersonalization of being a physician, burnout. Things that we didn't talk about 10 years, I'm sure was evident, but we're now starting to look at that and understand what do we have to do to help our physicians avoid burnout or emotional exhaustion, those kind of things. How satisfied are you with your current job? We have actually very good results from our physicians comparing 2016 to 2017 against the state and national averages. They like working for us in most cases. I think it's part of the culture. And then enough time for what's important. And lastly, if you look at this, it's very hard to see, but the number 1 concern of physicians was work-life balance. Very difficult to achieve, but how do you engage physicians to understand what work-life balance is? Meaningful work. Are you doing more than just a mill of trying to see 50 patients in an hour? That's very efficient, makes a lot of money, but is it meaningful to the physician? How do you provide them with meaningful work? And then the other one, high quality care, is very important to them. It wasn't until you get down to the 5th one about financial rewards. Yes, money is important, but it's not the top concerns to them. Okay, I'm going to end with one thing. As I said before, we are in the shadow of Mayo Clinic, 90 kilometers away from us. We cannot compete with Mayo on their breadth of expertise, on their clinical equipment, their technology, those kind of. How do we compete? Well, we've got very experienced staff, good clinical staff. We have some cutting-edge technology. But here's how we compete. We compete on 3 words. And this is what we train every new employee on and what we screen every employee on before they get a job with us. Kindness. Are they kind? And we tell them because the world needs kind people. Here's how you'll know that you walked into Ridgeview Medical Center. Everybody smiles. And when you smile at someone, they have to smile back. Secondly, we talk about compassion. If you are a caregiver or you support a caregiver, compassion is important because it heals you. Think about your physicians who are experiencing burnout and frustration. How do they heal themselves? Compassionate people actually heal themselves. And we teach what that looks like in our organization. Do what your heart tells you to do. Lastly, use your intuition. Not everything is in a guideline when it comes to a patient. Ask a deeper question. I sense I haven't answered all your questions, Mrs. Or is there anything else I can do for you? Touch them on the hand. If you, and we say in our organization, if you are kind and compassionate and use your intuition, that's a differentiator. That is our differentiator in our marketplace. So don't lose the personal touch. Thank you.